Yes, it's important first to diagnose craniopharyngioma, which is done by histological analysis of tissue. That means the patient needs an operation. And after this, we know that during the first year after this operation, patients who are at risk for hypothalamic obesity, they get weight. So during the first month, the patient should be monitored really closely. You should look at the endocrine situation, you should look at the eating behavior, and you should make sure that the patient is physically active. And looking at these parameters, you can try to make a diagnosis of hypothalamic obesity in these patients with craniopharyngioma. It's very important to have a team treating these patients right from the beginning. That means already before surgery, before diagnosis, there should be a team of neurosurgeons, endocrinologists, psychologists. You even should involve the radio-oncologists, people who do irradiation in these patients. And this team has to stick to the patient. This team has to get also the caregivers in the team. And these people should monitor the patient and follow him and give advice with regard to weight development, with regard to physical activity, with regard to medication. Yes, I think it's a completely different disease when you have general obesity or when you have hypothalamic obesity, for instance, in craniopharyngioma. These patients, they need endocrine medication, and that's a challenge because you have to find the right dosage of these medication in endocrine and hormonal substitution. When that's fine, you have to look for the physical activity, which is frequently impaired due to visual impairment, to neurological disease. And when everything is fine, most of these patients still have hypothalamic problems in a way that they get weight. And in this situation, we are nowadays happy that maybe in the future we will have new pharmacological treatment options. So we are very, very interested in the results of studies which will be available next year, I guess.